Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A 16-year-old unmarried preemie gravida client at 37 weeks gestation with severe preeclampsia is in early active labor. The client's blood pressure is 164/110, which of the following will alert the nurse that the client may be about to experience a seizure. 1. Decreased contraction intensity. 2. Decreased temperature. 3. Epigastric pain. 4. Hyperreflexia. The correct answer is 3. Epigastric pain or acute right upper quadrant pain is associated with the development of eclampsia and an impending seizure. This is thought to be related to liver ischemia. Decreased contraction intensity is unrelated to the severity of the preeclampsia. Typically, the client's temperature increases because of increased cerebral pressure. A decrease in temperature is unrelated to an impending seizure. Hyperreflexia is not associated with an impending seizure. Typically, the client would exhibit hyperreflexia. A 24-year-old client, G3, P1, at 32 weeks gestation, is admitted to the hospital because of vaginal bleeding. After reviewing the client's history, which of the following factors might lead the nurse to suspect abruptio placentae? 1. Several hypotensive episodes. 2. Previous low transverse cesarean birth. 3. One induced abortion. 4. History of cigarette smoking. The correct answer is 4. Although the exact cause of abruptio placentae is unknown, possible contributing factors include excessive intrauterine pressure caused by hydramnios or multiple pregnancy, cigarette smoking, alcohol ingestion, trauma, increased maternal age and parity, and amniotomy. A history of hypertension is associated with an increased risk of abruptio placentae. A previous low transverse cesarean section and a history of one induced abortion are associated with increased risk of placenta previa, not abruptio placentae. A client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? 1. I don't see any foreign agents. 2. I think these thoughts are frightening to you. 3. I don't know what you mean. 4. I'd like you to come to group with me right now. The correct answer is 2. The client's disturbed thought process likely reflects this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having visual hallucinations. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. A client diagnosed with paranoid schizophrenia is still withdrawn, unkempt, and unmotivated to get out of bed. A mental health aide asks the nurse why the client is this way after being on fluphenazine 10 milligrams for 7 days. The nurse should tell the health aide, 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. 2. The client will be less withdrawn and unmotivated when the fluphenazine takes effect. 3. The client's fluphenazine dose probably needs to be increased again. 4. Lack of motivation is a common side effect of fluphenazine. The correct answer is 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. Positive symptoms are those that are added to a person's experience, such as hallucinations, delusions, and disorganized thinking. The client's symptoms reflect the negative symptoms. Negative symptoms are things taken away from the person's experience, such as lack of emotional expression, lack of motivation or drive, and social withdrawal. Fluphenazine generally is effective in 3 to 7 days for the positive symptoms. An increased dose or longer time on fluphenazine will not help the negative symptoms of being withdrawn and unmotivated. Which of the following statements indicates increased insight by the client about her newly diagnosed paranoid schizophrenia being stabilized on medications? 1. Now that the voices are gone, I can decrease my medicines. 2. I would feel better if I knew that the food wasn't too dangerous to eat. 3. Since I feel better, I know I can restart school next week. 4. The voices go away when I tell them to, except if I'm really nervous. The correct answer is 4. The statement about the voices occurring if the client is nervous reflects awareness that stress and anxiety can increase the positive symptoms of schizophrenia. Decreasing the medications because the voices are gone reveals a lack of awareness about the need for the medications to control the client's symptoms. Stating that the food is dangerous to eat demonstrates a lack of insight into the client's delusions. Restarting school in a week reflects an unrealistic expectation for a client who is newly diagnosed and being stabilized on medications. The client with tuberculosis is to be discharged home with community health nursing follow-up of the following nursing interventions, which should have the highest priority. 1. Offering the client emotional support. 2. Teaching the client about the disease and its treatment. 3. Coordinating various agency services. 4. Assessing the client's environment for sanitation. The correct answer is 2. Ensuring that the client is well educated about tuberculosis is the highest priority. Education of the client and family is essential to help the client understand the need for completing the prescribed drug therapy to cure the disease. Offering the client emotional support, coordinating various agency services, and assessing the environment may be part of the care for the client with tuberculosis. However, these interventions are of less importance than education about the disease process and its treatment. The nurse should include which of the following instructions when developing a teaching plan for a client who is receiving isoniazid and rifampin for treatment of tuberculosis? 1. Take the medication with antacids. 2. Double the dosage if a drug dose is missed. 3. Increase intake of dairy products. 4. Limit alcohol intake. The correct answer is 4. Isoniazid and rifampin is a hepatotoxic drug. The client should be warned to limit intake of alcohol during drug therapy. The drug should be taken on an empty stomach. If antacids are needed for gastrointestinal distress, they should be taken 1 hour before or 2 hours after the drug is administered. The client should not double the dose of the drug because of potential toxicity. The client taking the drug should avoid foods that are rich in tyramine, such as cheese and dairy products, or he may develop hypertension. A child diagnosed with tetralogy of Fallot becomes upset, crying and thrashing around when a blood specimen is obtained. The child's color becomes blue, and the respiratory rate increases to 44 breaths per minute. Which of the following actions should the nurse do first? 1. Obtain a prescription for sedation for the child. 2. Assess for an irregular heart rate and rhythm. 3. Explain to the child that it will only hurt for a short time. 4. Place the child in a knee to chest position. The correct answer is 4. The child is experiencing a hypercyanotic or hypoxic episode. Therefore, the nurse should place the child in a knee to chest position. Flexing the legs reduces venous flow of blood from the lower extremities and reduces the volume of blood being shunted to the interventricular septal defect and the overriding aorta in the child with tetralogy of Fallot. As a result, the blood then entering the systemic circulation has higher oxygen content, and dyspnea is reduced. Flexing the legs also increases vascular resistance and pressure in the left ventricle. An infant often assumes a knee-to-chest position in the crib, or the mother learns to put the infant over her shoulder while holding the child in a knee-to-chest position to relieve dyspnea. If this position is ineffective, then the child may need a sedative. Once the child is in the position, the nurse may assess for an irregular heart rate and rhythm. Explaining to the child that it will only hurt for a short time does nothing to alleviate the hypoxia. A 32-year-old multigravida returns to the clinic for a routine prenatal visit at 36 weeks gestation. The assessments during this visit include BP 140 over 90, pulse 80, and +2 edema of the ankles and feet. What further information should the nurse obtain to determine if this client is becoming preeclamptic? 1. Headaches. 2. Blood glucose level. 3. Proteinuria. 4. Edema in lower extremities. The correct answer is 3. The two major defining characteristics of preeclampsia are blood pressure elevation of 140 over 90 or greater and proteinuria. Because the client's blood pressure meets the gestational hypertension criteria, the next nursing responsibility is to determine if she has protein in her urine. If she does not, then she may be having transient hypertension. The edema is within normal limits for someone at this gestational age, particularly because it is in the lower extremities. The preeclamptic client will have significant edema in the face and hands. Headaches are significant in pregnancy-induced hypertension, but may have other etiologies. The client's blood glucose level has no bearing on a preeclampsia diagnosis. The primary healthcare provider prescribes intravenous magnesium sulfate for a preemie gravida client at 38 weeks gestation diagnosed with severe preeclampsia. Which of the following medications should the nurse have readily available at the client's bedside? 1. Diazepam. 2. Hydralazine. 3. Calcium gluconate. 4. Phenytoin. The correct answer is 3. The client receiving magnesium sulfate intravenously is at risk for possible toxicity. The antidote for magnesium sulfate toxicity is calcium gluconate, which should be readily available at the client's bedside. Diazepam, used to treat anxiety, usually is not given to pregnant women. Hydralazine would be used to treat hypertension, and phenytoin would be used to treat seizures. Following an eclamptic seizure, the nurse should assess the client for which of the following? 1. Polyuria. 2. Facial flushing. 3. Hypotension. 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor. Because the client will not be able to verbalize that contractions are occurring, oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications, such as magnesium sulfate, are administered. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextrose solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextrose solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. Police bring a client to the emergency department after she threatens to delete her ex-husband. She states emphatically, "The police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything." In which order should the following nursing actions be done from first to last? 1. Ask about the marital problems leading to the divorce. 2. Assess the client's risk for harm to self and others. 3. Obtain the name of her ex-husband's case manager. 4. Interview the client about her current needs and situation. The correct order is 2, 4, 3, 1. The nurse should first assess the client's risk for harm, especially because the client could direct her anger toward her ex-husband or the nurse. Then it is important to know more about her current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. A pregnant client in her third trimester is started on chlorpromazine 25 milligrams 4 times daily. Which of the following instructions is most important for the nurse to include in the client's teaching plan? 1. Don't drive because there's a possibility of seizures occurring. 2. Avoid going out in the sun without a sunscreen with sun protection factor of 25. 3. Stop the medication immediately if constipation occurs. 4. Tell your doctor if you experience an increase in blood pressure. The correct answer is 2. Chlorpromazine is a low-potency antipsychotic that is likely to cause sun-sensitive skin. Therefore, the client needs instructions about using sunscreen with sun protection factor 25 or higher. Typically, chlorpromazine is not associated with an increased risk of seizures. Although constipation is a common adverse effect of this drug, it can be managed with diet, fluids, and exercise. The drug does not need to be discontinued. Chlorpromazine is associated with postural hypotension, not hypertension. Additionally, if postural hypotension occurs, safety measures, such as changing position slowly and dangling the feet before rising, not stopping the drug, are instituted. A client who is suspicious of others, including staff, is brought to the hospital wearing a wrinkled dress with stains on the front. Assessment also reveals a flat effect, confusion, and slow movements. Which goal should the nurse identify as the initial priority when planning this client's care? 1. Helping the client feel safe and accepted. 2. Introducing the client to other clients. 3. Giving the client information about the program. 4. Providing the client with clean, comfortable clothes. The correct answer is 1. The initial priority for this client is to help her overcome suspiciousness of others, including staff, and thereby feel safe and accepted. Introducing the client to others, giving the client information about the program, and providing clean clothes are important, but these are of lower priority than helping the client feel safe and accepted. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative, 2. Needing to be repeated, 3. Positive, 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm, raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm, raised area, or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. A client who has been diagnosed with tuberculosis has been placed on drug therapy. The medication regimen includes rifampin. Which of the following instructions should the nurse include in the client's teaching plan related to the potential adverse effects of rifampin? Select all that apply. 1. Having eye examinations every 6 months. 2. Maintaining follow-up monitoring of liver enzymes. 3. Decreasing protein intake in the diet. 4. Avoiding alcohol intake. 5. The urine may have an orange color. The correct answers are 2, 4, and 5. A potential adverse effect of rifampin is hepatotoxicity. Clients should be instructed to avoid alcohol intake while taking rifampin and keep follow-up appointments for periodic monitoring of liver enzyme levels to detect liver toxicity. Rifampin causes the urine to turn an orange color, and the client should understand that this is normal. It is not necessary to restrict protein intake in the diet or have the eyes examined due to rifampin therapy. When teaching a preschool-age child how to perform coughing and deep breathing exercises before corrective surgery for tetralogy of Fallot, which of the following teaching and learning principles should the nurse address first? 1. Organizing information to be taught in a logical sequence. 2. Arranging to use actual equipment for demonstrations. 3. Building the teaching on the child's current level of knowledge. 4. Presenting the information in order from simplest to most complex. The correct answer is 3. Before developing any teaching program for a child, the nurse's first step is to assess the child to determine what is already known. Most older preschool children have some understanding of a condition present since birth. However, the child's interest will soon be lost if familiar material is repeated too often. The nurse can then organize the information in a sequence because there are several steps to be demonstrated. These exercises do not require the use of equipment. The nurse should judge the amount and complexity of the information to be provided based on the child's current knowledge and response to teaching. The nurse is instructing a pre-eclamptic client about monitoring the movements of her fetus to determine fetal well-being. Which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement? 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or if the fetus stops moving for 12 hours or longer. For the client who is receiving intravenous magnesium sulfate, for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progressing to coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. A client at 36 weeks gestation begins to exhibit signs of labor after an eclamptic seizure. The nurse should assess the client for 1. Abruptio placentae. 2. Transverse lie. 3. Placenta accreta. 4. Uterine atony. The correct answer is 1. After an eclamptic seizure, the client is at risk for abruptio placentae due to severe vasoconstriction resulting in hemorrhage into the decidua basalis. Abruptio placentae is manifested by a board-like abdomen and an abnormal fetal heart rate tracing. Transverse lie or shoulder presentation, placenta accreta, and uterine atony are not related to eclampsia. Causes of a transverse lie may include relaxation of the abdominal wall secondary to grand multiparity, preterm fetus, placenta previa, abnormal uterus, contracted pelvis, and excessive amniotic fluid. Placenta accreta, a rare phenomenon, refers to a condition in which the placenta abnormally adheres to the uterine lining. Uterine atony, or relaxed uterus, may occur after childbirth, leading to postpartum hemorrhage. When assessing a 34-year-old multigravida client at 34 weeks gestation experiencing moderate vaginal bleeding, which the following would most likely alert the nurse that placenta previa is present. 1. Painless vaginal bleeding. 2. Uterine tetany. 3. Intermittent pain with spotting. 4. Dull lower back pain. The correct answer is 1. The most common assessment finding associated with placenta previa is painless vaginal bleeding. With placenta previa, the placenta is abnormally implanted, covering a portion or all of the cervical OS. Uterine tetany, intermittent pain with spotting, and dull lower back pain are not associated with placenta previa. Uterine tetany is associated with oxytocin administration. Intermittent pain with spotting commonly is associated with spontaneous abortion. Dull lower back pain is commonly associated with poor maternal posture or a urinary tract infection with renal involvement. A client who has been stabilized on medications for several months is at the clinic for a medication check. During conversation with a nurse, the client suddenly jumps up, begins pacing, and wrings her hands. In what order should the nurse do the following interventions from first to last? 1. Walk with the client to help decrease her anxiety. 2. Discuss productive ways to solve her problems causing anxiety. 3. Share observations about her anxiety-related behaviors. 4. Ask the client about the sources of her anxiety. The correct order is 1, 3, 4, 2. The nurse should first walk with the client to reduce her anxiety because the client must be at a mild level of anxiety before learning can occur. Sharing observations with the client conveys a sense of caring. Later, the nurse can help the client connect the anxiety-related behaviors to her feelings of anxiety. Once the client can identify the source of her anxiety, she can talk about solutions. The parent of a young adult client diagnosed with paranoid schizophrenia is asking questions about his son's antipsychotic medication, ziprasidone. Which of the following statements by the father reflects a need for further teaching? 1. If he experiences restlessness or muscle stiffness, he should tell the doctor. 2. I should give him benztropine to help prevent constipation from the ziprasidone. 3. If he becomes dizzy, I'll make sure he doesn't drive. 4. The ziprasidone should help him be more motivated and less withdrawn. The correct answer is 2. Constipation caused by medication is best managed by diet, fluids, and exercise. Benztropine can increase constipation. However, it may be prescribed for restlessness and stiffness. Restlessness and stiffness should be reported to the primary healthcare provider. Drowsiness and dizziness are adverse effects of ziprasidone. Clients should not drive if they are experiencing dizziness. Ziprasidone does help improve the negative symptoms of schizophrenia, such as avolition. A client reports that men in blue clothes keep looking in her window and talking about her. Which of the following responses by the nurse is most appropriate? 1. Those men are groundskeepers. They're talking about their work, not you. 2. Don't take things so personally. Not everyone who is talking about you. 3. Let's not pay attention to men. Let's play cards instead. 4. I'll close the drapes so you can't see the men. The correct answer is 1. The nurse needs to present the reality of the situation. By explaining that the men are groundskeepers and probably talking about work, the nurse is reinforcing reality to counter the client's illusion. Additionally, this response voices doubt in the client's paranoid interpretation. Telling the client not to take things personally is flippant and judgmental. Telling the client to not pay attention to the men fails to address the client's misinterpretations and misperceptions. Closing the drapes so that the client doesn't see the men ignores the client's misperceptions and misinterpretation.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.